It's usually from beans and rice and other products. And these are usually called low biological value protein because there are some missing essential amino acid. However, we also have another concept of complementary protein. So the beans are missing 2 amino acids, right? Rice is missing 1 amino acid. So when these 2 are consumed together, it can produce complete protein. So we call it as complementary protein. So it's as good as you consume the animal protein. The third macronutrient is fat. It produces 9 calories per gram, and it's very important for body function as well, produce hormone, protect vital organs, component of the membranes, and there are different types of fat. Those are saturated fat, unsaturated fat, trans, and cholesterol. So we all know about the saturated fat. It's usually coming from the animal sources, and unsaturated, it's also the plant oil, nuts, and also just the fish. And trans fat is actually unsaturated, but added hydrogen, and then it looked like exactly same as the saturated fat. And cholesterol doesn't give any calories. So different type of nutrient is a micronutrient, and these are essential for the body function, and these are vitamins and minerals. They are necessary for the body function, but body do not make any of these. So we can get them from food sources and the supplement. The vitamins, 2 types of vitamins. One is fat-soluble vitamins, and if we have a large quantity, they are stored in the body. These are A, D, E, K, and all of them, if it's too much, it will be toxic. Water-soluble vitamins, these are B vitamins, vitamin C, and these are, if we consume too much, they are excreted to the urine, so they are not stored in the body. The other micronutrients are minerals. There are sodium, potassium, chloride, calcium, phosphorus, sulfur, and magnesium. Those are usually, we require a little large quantity compared to other minerals such as iron, selenium, zinc, and other trace elements. All of these are smaller quantity compared to the other minerals, and we can get them through food sources and also from the vitamin or mineral supplement. So next section, I'm going to go over water and PKD. We talk about water all the time with the polycystic kidney disease because the vasopressin is antidiuretic hormone. It's also called arginine vasopressin. It's very important in maintaining body homeostasis, especially maintaining about osmotic balance and also blood pressure. So the vasopressin promotes the water reabsorption in the kidney and also decrease water loss and dehydration in the body. And that can also cause increase of the blood pressure, but those are all going to be maintenance of the homeostasis of the vasopressin. In PKD, vasopressin level is high for the PKD patient. And also vasopressin contributed to cyst growth. That's why we talk about water a lot. So these are factors affecting vasopressin. So when people consume less water intake, they will increase vasopressin to reabsorb more water to balance. And also, if people consume high protein consumption, it can affect to increase vasopressin, obesity, metabolic syndrome, high blood sugar, all of them contributed to increased vasopressin. The caffeine has some mixed report, so it's not very clear. And most studies, actually, PKD patients do not consume a lot of caffeine. So that is one of the reasons that the data may not be that clear. So when vasopressin level is high, it will increase the cyst growth, and then that will increase total kidney volume. The dietary sodium also directly affected to total kidney volume by kidney cyst growth. So benefit of water consumption in PKD, the recommendation is usually more than 3 liters of water intake that will decrease blood vasopressin level, that will produce lower urine osmolality, which is diluted water, diluted urine. It also protein, sodium, and some preserves. Those are all, like, if they are lower, it's called low osmolar diet. So that will also decrease blood vasopressin, and then it can also produce less concentrated urine, diluted urine. So that's actually good for decreased cyst growth. And that is the major benefit about water with the PKD patient. So next thing is nutrition and the PKD. I always talk about the causes of chronic kidney disease because polycystic kidney disease is one of the causes of the chronic kidney disease. Of course, number one cause is diabetes, followed by the high blood pressure, and often our patient, the PKD patient, have this. So these other causes, that's where the PKD patient, PKD is in the cause. So there are 5 different stages of chronic kidney disease, and higher the number, higher the stage, it just go to kidney failure. And most of our PKD patients also have a good kidney function when I see them. And we try to talk to patient when patient reach stage 3 or stage 3B. So we can just discuss about the PKD and as well as the CKD. So polycystic kidney disease is inherited disorder clusters of the cyst developed primarily within kidneys, causing kidneys to enlarge and lose function over time. So with the age, once patient gets older, the cyst grow, and then about age around 60, the kidney function goes down very fast. So nutrition goals for PKD include maintain healthy body weight, adequate fluid intake, eating healthy, and these will be some dietary restrictions, and then control existing medical conditions, diabetes and also hypertension most of the time. To maintain healthy weight, we used pounds. So 1 kilogram is 2.2 pounds. And then we also look at the body mass index, BMIs, because that's where we look at the classification of the weight status. So the calculation can be either metric system or the system we are using. They all need adequate calories, exercise as tolerate for to maintain body weight. And I'm going to show this. What does it tell you? So BMI doesn't show the body composition. It just has, if someone has 6 feet, same weight, 250, and same BMI. So this man has a lot of muscle mass. This man is obese. So because of it doesn't show about the body composition, we do not depend on body mass index by itself. So the most dietitians usually work on other body composition and other things to determine. And this green area is with the height and also weight, and those are like this area is the normal BMI, and they are not extremely muscle, like they don't have extreme muscle mass. So for the maintain healthy weight, we follow the weight management and PKD diet recommendation. So low calorie diet, it also based on individual's need. So if someone wants to lose 1 pound weight loss per week, just consume 500 calories less per day. And if someone like to lose 2-pound weight loss per week, usually less than 1,000 calories per day. But we do not recommend the less than 1,200 calories per day because quite often it's difficult to maintain healthy nutrient balance. And of course, at the beginning of those weight loss diet, many people start losing more than 2 pounds or 3 pounds at the beginning for a few weeks because due to the water loss. The moderate protein is important for our PKD patient, and this is goal 0.8 gram per kilogram per day. And we also do not recommend a lot of starch or sugar, but we recommend more complex carbohydrate, more fruit and vegetables as part of the carbohydrate. The physical activity is very important. It's more important to maintain the weight than weight loss. So weight loss is more low calorie. And also, as we discussed, high fluid consumption. Make sure that 3 liters of water, and that's recommended. The physical activity, we do not recommend the vigorous exercise because we don't want PKD patient rupture some of the cyst. There are many various types of diet, but we do not recommend any one specific type, and any type of diet which can fit patient's lifestyle. The water recommendation, the adequate water consumption is more than 3 liters per day, as long as patient does not have hyponatremia, the low sodium level in the blood, and no sugar-containing fluid like juice and soda we do not recommend. And caffeine consumption, we usually limit to 1 cup of coffee a day. People take tolvaptan, blocking vasopressin on the kidney, and it also lowers circulating vasopressin and lowers cyst growth. However, vasopressin also causes more free water loss in the urine. So just people who take tolvaptan recommend higher fluid intake, more like about 4 liters or more. So those are just the weight and water recommendation. So next section is going to be healthy eating for PKD. So as I mentioned, PKD is one of the causes of CKD. So we need appropriate diet to slow the progression of CKD. And these include protein, sodium, potassium, phosphorus, and especially for PKD patients, there are people who talk about low oxalate diet. That's not for just the non-PKD, CKD progression. So most important fact is all this diet should be individualized because although people have PKD, also everyone has different stages of CKD and different numbers. So the diet should be individualized. That's most important. The protein should be used as main energy source because protein increases filtration rate in the kidney, and also the protein metabolism occurs in the kidney, affect progression of the kidney disease. And I just spoke earlier about the protein is high osmolar, so also it can increase the cyst growth. The amount of protein recommendation is based on body weight. So everyone has different amount of protein recommendation. The adequate calories are necessary to maintain body weight or to lose weight if necessary. So not just protein, we also look at the calories. So high protein, low carb diet for weight management should be avoided for patients with the PKD and also chronic kidney disease because high protein can promote the cyst growth and also progression of the kidney disease. Meat, fish, poultry must be measured after cooking without bones, skin, or fat. The plant-based diet is not better than regular diet based on 2020 KDOK, which is the Kidney Disease Outcomes Quality Initiative, which is the standard recommendation for CKD patient. Even though there are a lot of discussion about the plant-based diet would be better, there would be some benefit. But for general guidelines, they do not give enough evidence. So this is example of low protein diet. So just this is about 45 gram to 65 gram of protein per day. Have vegetables, fruit. Those are all each meal. The protein is going to be about 3 ounces once or twice per day. It's just a regular diet. And also starches or grain, 1 or 2 servings, but we recommend more on the multigrain and high fiber carbohydrate. And also some fruit and vegetables are not allowed if the patient have high potassium level. So next nutrient is the sodium. So what does sodium do in the body? It can cause thirst if someone eats all this salty food, drink more water. And once you drink too much water with sodium, it will hold the fluid, it will increase blood pressure. How much sodium do you need per day? It's 1 teaspoon of salt, which is 2,300 milligrams of sodium. And I always tell my patient, it's not regular teaspoon, it's the measuring teaspoon. So it's a very small amount. And this 1,500 milligram was a low osmolar diet. And the other questions I often get is, what is the best salt to use in cooking? They talk about kosher salt, sea salt, or Himalayan salt are better. Unfortunately, they are all about the same. They give the same amount of sodium. They may have a different taste, but all of them are exactly the same. Some people like to use light salt or salt to substitute. They are low in sodium, but also very high in potassium. So if someone is watching potassium, this is not a good choice. Mrs. Dash is usually acceptable for our patient. And everyone should read nutrition label. So when the A is just showing you this, always check the portion size and how many portions per container. Someone can watch for calories, but always check the sodium. This label has a sodium as 160 grams, which is a mistake by the manufacturer. So this is actually milligram of the sodium, not the gram. And also other nutrient a patient can read, it's just the sugar, also looking at the potassium. But the sodium, you could go by about 7% or like less than 5% would be good, because the general recommendation of sodium is 2,400 milligrams for healthy Americans. However, potassium, you shouldn't go by the percentage, because the US public recommend very high potassium, about above 4,000 or close to 5,000 milligrams a day. So always to check the amount of the potassium. And also this is exactly about 1 cup versus 2 cups, and different kind of the portion. So these are examples of high sodium food, processed food, canned food, frozen dinner. Those are all high sodium. Low sodium food are fresh food, frozen vegetables, low sodium canned food. So like black beans with the low sodium. The definition of low sodium is less than 140 milligrams. So usually when they mention about low sodium, the serving size is less than 140. I also put the goal as a 2,000 to 2,300 milligram per day. The reason is many of our patients also have cardiovascular disease. So American Heart Association recommended 2,000 milligram of sodium, and Kidney Foundation recommended 2,300 milligram. So anywhere between 2,000 and 2,000 milligram of sodium per day would be acceptable for our patient population. Potassium. Why potassium is important? It's an electrolyte. It's very important for muscle contraction, especially heart. And what can cause elevation of potassium? There are blood pressure medications. Many of our patients take lisinopril, nystatin. These are what we call angiotensin converting enzyme inhibitors. So those all end with the PRIL. And the other one is angiotensin receptor blocker. It's all end with SARTAN. So there are lisinopril, captopril, there are nystatin, valsartan, irbesartan, there are different kinds. And this is spironolactone, is the diuretics that preserve the it save the potassium, because other diuretics usually decrease the potassium in the blood. So this is potassium sparing diuretics. And people take these medications and consuming very high potassium consumption, there is a risk of increased potassium in the blood. And then everyone should know about what the normal range is. The safe zone, we usually go by 3.5 to 5, but it can vary by the different labs. So some institute can have a little bit less, some labs have a little bit more. But in general, about 3.5 to 5 would be the normal range. And the caution will be 5.1 to 5.9. But our institute, we usually discuss about low potassium diet when patients have a potassium level of 5.5. The danger level is usually above 6. And then this patient usually are sent to emergency, and they usually check the EKG. So important fact is always know your potassium level, but not everyone need a potassium restriction. Only people who has high potassium or taking these medications probably will cause with the caution of the some high potassium intake. And these are high and low potassium food. So high potassium food are potatoes, white, sweet, yam, purple, all kinds of potatoes, tomato product, banana, prunes, coconut milk. It used to be very high in potassium. They have different variety of coconut milk. They are not high in potassium, but coconut water is still very high in potassium. Beans, raisin bran, and salt substitute. All of these are very high. The low potassium food are rice, noodles, some berries, cauliflower, and different kinds of vegetables. But all protein food are high in potassium. But we always recommend low potassium fruit and vegetables because the protein are very important for the body. So patient can choose low potassium fruit and vegetables because there are a variety of different ones. And the other thing is the portion size is also very important. If someone consumes large quantity of low potassium food, it can also give same effect as high potassium consumption. And also amount of potassium will be individualized because everyone has different amount of protein. Also, everyone is different. And there are some potassium lowering medication. Sometimes we use them if patient continue to have a high potassium level. So next one is the phosphorus. The phosphorus is also mineral that helps the bone healthy. It keeps our blood vessels and muscle working in the body. But why phosphorus is important with the polycystic kidney disease and also chronic kidney disease? With the progression of the CKD, phosphorus can be built up in the blood because kidney is not able to eliminate extra phosphorus. We usually see high phosphorus patient when a patient has a late stage 4 and stage 5. For PKD patient, Also, phosphorus is a major component of the preserves and food additives. So if patient is consuming large preserves, also it may also be part of the high osmolar food. But the decreased protein consumption, it can also lower phosphorus intake. So should phosphorus be restricted for PKD or CKD? The moderate amount is more important for PKD because it has the high osmolar diet. But the CKD patient, we don't usually restrict phosphorus until their blood phosphorus level goes up. And also everyone has to understand about bioavailability of the phosphorus. So these high phosphorus, all animal protein food rich in protein, also especially dairy product, organ meat, they are all very high in phosphorus. Other protein food like plant-based protein, beans, brand products, nuts, and seed. They are all protein sources from the plant-based, but their bioavailability is lower. The processed food have all food additives. These food additives, they have 100% of the phosphorus absorption. The animal protein have about 70% absorption, and this plant-based 50%. So that's why we have to pay attention on the bioavailability of the phosphorus. And low phosphorus food are fresh fruit and vegetables, non-dairy, milk, bread and pasta, and all this just the corn and rice cereals. Oxalate. We don't talk about oxalate often for a CKD patient. The reason is it doesn't we don't have many stone patients with the CKD, but the oxalate in human, just especially the autosomal dominant PKD patient have a higher risk of the kidney stone, both calcium oxalate and also uric acid. But in animal studies, actually the reason is this crystal can pass the this tubule, but with the dilation of tubule, but the PKD, this is a persistent, just growth of the dilation can cause the cyst growth. But in normal kidney, it went back to the regular size, the normal size of the tuber. But unfortunately, these are only showing in the animal studies. So there is no human study recommend a low oxalate diet for PKD. And PKD patient already consume large amount of water. And one of the kidney stone prevention diet is a large fluid intake. And also high oxalate food are usually healthy food. And for our patient, I usually recommend adequate amount of calcium paired with the oxalate food together. And those usually lower the oxalate absorption in the GI, and it also lowered the kidney stone risk, and still they can consume healthy eating. So next section, I will talk to you about the various diet, because the keto diet became very, very popular nowadays. And I have so many questions from the PKD patient, whether this keto diet is safe. And the other healthy diet is a Mediterranean diet, and the vegetarian diet, intermittent fasting. So ketogenic diet, actually, there are different types, but I only put two of them. So classic keto diet is 90% fat, 4% carbohydrate, and 6% protein. Those are all based on the calories. And actually, that's the treatment for epilepsy. So it's ketones. This diet is very consistent. It has less various ketones. Modified keto diet, Atkins diet, is high fat, low carb, no restriction of protein or calories. So the fat is 60 to 65%, 5 to 10% of carbohydrate, protein is 25 to 35%. Those are very high portion of protein. And also we talk about there is no calorie restriction. And this is the most popular weight loss diet among Americans. And it has a large food volume. And also it's just like people do not feel hungry. So I just show these pictures about the just the more healthier keto diet versus really not very healthy modified keto diet. Nowadays, the question is more plant-based keto diet with the beta-hydroxybutyrate supplement for PKD patient. And I will just to show one human study a little bit later. So keto diet can have an adverse effect. So it's called ketosis. So this is for all ketogenic diet. So these are the adverse effects include metabolic acidosis, excess ketones, dyslipidemia, and GI issues, especially nausea, vomit, diarrhea, and constipation. These are very common. Dehydration if someone does not consume enough fluid. Also, because of the low consumption of carbohydrate, have a low blood sugar. And if someone is diabetic, often they have to adjust some medication dose, and people lose some weight also by ketogenic diet and low blood pressure. And some people do not need to lose weight. So unintentional weight loss is another side effect. So this is the ketogenic diet research in PKD. In animal studies, so if you see this figure that high carbohydrate diet and this intermittent fasting ketogenic diet and the beta-hydroxybutyrate, it just supplement. So this will just inhibit the cyst growth. However, this general diet, it just still increase the cyst growth. So those are like time-restricted feeding, food restriction, and the ketogenic diet. And this is only proven for animal studies. I just have one study that I'm going to show for the human. It's a RESET PKD study. There are a very small number of the patients. Only 10 patients were in the study. And ketogenic diet is for 14 days. And this patient have also 3-day water fasting, only had like water and some broth. And they checked multiple imaging, and they also went back to the carbohydrate-rich diet. And there were no changes of total kidney volume and no benefit monitored in short-term study. So of course, these are very short-term and very difficult to identify, but they all have very high ketone bodies. And because the ketone body is also produced in the fasting status, especially starvation. So this short study did not show any benefit of total kidney volume this time. And that is, this is the study from 2021, Nephrology and Dialysis Transplant Journal. And also there is a website that you can check. And there are more data from studies coming in the future. So until we find more data, I'm not going to recommend any ketogenic diet in PKD population right now. The other healthy diet is Mediterranean diet. It's recommended for cardiovascular disease, delay progression of CKD. It has abundance of plant food, also minimal red and processed meat. Those will all lower the phosphorus also. Moderate amount of dairy product, olive oil as main fat source, the moderate amount of wine with the meals. So this is only recommended for pre-dialysis CKD patient. And these are just improving their lipid profile based on KDOQI guideline 2020, but not for the dialysis or post-transplant patient. The vegetarian diet, there are different vegetarian diet. I only present with lacto-ovo vegetarian and vegan diet. So lacto-ovo vegetarian consume mostly plant food, but include the dairy product, milk and yogurt, and some cheese, and also eggs. The vegan diet is all protein, no animal product, no dairy. One of the vegan diet have to be careful with iron, also vitamin B12, and some calcium. So some of them also have the supplement. However, again, there is no specific benefit for PKD or CKD. The intermittent fasting is another very popular meal plan for many people like to follow. Unfortunately, there is no proven health benefit for PKD patient. It's not recommended for a patient with diabetes because the most common fasting is 16 hours fasting and 8 hours of eating. So when someone does not have good blood sugar control, it's sometimes it's not really efficient for, often they get the hypoglycemia. But with the cultural aspect, the diet plan can be modified based on patient's individual need. So the next section is going to be the sample healthy meal plan. I just created this meal plan for just overweight women with a BMI of 28.2, no extreme muscle mass. So the maintenance calorie is between 1750 to 2100 calories. The protein recommendation is about 56, like close to 60 grams. Sodium is less than 2,300 milligrams. Of course, the fluid will be about 3 liters or more. So this meal plan I just created is about 1,400 calories, about close to 60 grams protein, and about 1,500 milligrams of sodium. So I used unsweetened almond milk because it has a low protein in there. So the person can, if just consuming regular food, can have a little bit more protein because the regular milk has 8 grams of protein for 1 cup and also high phosphorus. So usually the 5 ounces of lean protein will be 2 ounces for lunchtime and 3 ounces for dinner time, which is very little. And most of the time when we get the grilled chicken salad, usually most of the restaurant or any place, they provide about 6 ounces, which is more than 1 day of this protein recommendation. And they can have a lot of vegetables, fruit, and also some starch, complex carbohydrate, and just olive oil or any kind of healthy fat. And of course, drink 3 liters of water and some tea. Same person with a vegetarian option. It just, this one provide about a little more calories. The reason that more calorie is this meal plan can have a little bit more grain because of the protein can coming from the vegetable sources or grains. So have a lot of fruit and vegetables, the same, and also some tofu or quinoa. So any of those a little bit higher, just protein from vegetables or beans are good. And I just made a lacto-ovo vegetarian meal plan. So I have a little bit of cheese in there so they can have a little animal protein. And also give like 1,500 calories. So the vegetarian diet already does not mean that it's always low in calories. It's depending on how we plan. And all of this diet can be also based on patients they actually like to have this diet. So we can always make a meal plan individualized. So healthy eating with high fluid intake is the most appropriate for all PKD patients, and moderate to low protein is the appropriate amount based on patient's weight. Low sodium is always important for a PKD patient. And there is no sufficient evidence that vegetarian diet or intermittent fasting is better than regular diet for PKD patient. There are no beneficial effect on cyst growth in short-term study with a very small number of patients in keto diet and fasting. That is the RESET PKD study, which was published last year. And there are more human studies of keto diet are on the way. So as I told you, I wouldn't recommend any keto diet with any kind of supplement, keto acid supplement this time, because we don't have any good proof yet. So we'll just follow our healthy eating for all of our patients and good fluid, and all diet recommendation for this PKD patient should be individualized based on patient's current medical condition, weight status, and cultural background. Thank you.